donating blood. Why you should donate blood is a passage from the American Red Cross retrieved in 2014. It says you don't need a special reason to give blood, you just need your own reason. Some of us give blood because we are asked by a friend. Some know that a family member or a friend is going to eventually need blood someday. Some believe it's the right thing to do. Whatever the reason, the need is constant and your contribution is important but for a healthy and reliable blood supply. And you'll feel good knowing your blood helped change a life. Many people don't see the importance or like to donate blood because their excuse is that they need their blood, if not they'll die. But it's not like when you donate blood, they're gonna just drain you out. But according to How Does a Body Replace Blood, an article from oneblood.org, retrieved in 2014 says, your body makes about 2 million new red cells every second. A number of other messenger proteins also stimulate the production of white cells and platelets in the bone marrow. And over the next few days, your levels return to normal. During my high school year, I donated blood 3 times, and it just wasn't, I didn't do it just because of the shirts they gave you or the snacks you got after donating blood, but because it felt right to do it, and it was a nice thing, like to help save somebody else's lives. The way we see things gives it its value. By that I mean, like, if you don't think donating blood is important, then it's not going to matter to you. But our decision, whether it's donating blood or not donating, gives the importance to the donation of blood because the way we see it gives it its value. So those who don't like donating blood don't see the importance in it. First, I will speak about how donating blood can benefit the donor. Second, how the donated blood helps the recipient, which is a receiver. And finally, the blood donation process. Okay, so first I'm going to talk to you about the health benefits of donating blood. Those are the health benefits the donor receives. According to the article Health Benefits of Donating Blood, published in oneblood.org, retrieved in 2014, iron has a significant impact on atherosclerosis, or hardening of the arteries. When you give blood, you're removing 225 to 250 milligrams of iron from your system, thus cutting the risk of heart disease. It is also said to be that women have half the amount of iron as men because they lose iron every month through menstruation. However, once women hit menopause, their risk of a heart attack increases, but by donating blood, you can decrease that. Also, when donating blood, the doctors and nurses give you a free mini physical to let you know how your blood pressure and cholesterol level are. These 2 factors are a major risk when it comes to heart disease. So not only does donating blood help the recipient, but also the donor. I just spoke about how donating blood can benefit the donor, and now we'll discuss how it not only benefits the donor, but also the recipient. Well, of course, it benefits them because they're the one receiving it. So, according to the article Why Give Blood in blood.co.uk, retrieved in 2014, red cells are used predominantly in treatments for cancer and blood diseases, as well as treating anemia and in surgeries for transplants and burns. Plasma provides proteins, nutrients, and a clotting agent that is vital to stop bleeding. It is the most versatile component of your blood. Platelets repair damaged body tissue. An average of red blood cell transfusion is approximately 3 pence, and the victim of a car accident requires 100 pence of blood, as mentioned in Facts About Blood Needs from Red Cross, I forgot what that says, retrieved in 2014. So The amount of blood being taken out of you when you donate is just 1 pint, and 1 pint can save 3 lives. And that's not really that much, because as you can see, a person in a car accident requires 100 pints. Now that you know about how blood donation can benefit the donor and the recipient, I want to tell you about the blood donation process. So maybe then you can all go donate blood. According to the, sorry if you can see this, it was hard to make it visible. According to the article, Facts About the Blood Donation Process on redcrossblood.org retrieved in 2014, a sterile needle is used only once for each donor, and they discard it after they used it on that one person. The actual blood donation takes less than 10 to 12 minutes, but the entire time from when you enter the whole donation process till you finish takes about an hour and 15 minutes. The average adult has about 10 pints of blood in their body, and 1 pint is given during a donation. And a healthy donor may donate every 56 days. That's how long it takes your blood to come back, accumulate. So, and all donated blood is tested for any infectious diseases before being released to the hospital. From my experience of donating blood, there are 4 steps which I remember that happens when you donate blood. First, you have to register. Then they give you a paper you have to fill out asking you about your medical history, and then you receive a mini physical check. And then towards the end, after you donate blood, you receive refreshments. Some places they give you shirts, other places don't. And then the mini physical, they check your temperature, your blood pressure, your pulse, and your hemoglobin, which is a red protein responsible for transporting oxygen in the blood vertebrates, as mentioned in Webster's Dictionary, retrieved in 2014. To finish this up, I have discussed the importance of donating blood and how it not only benefits the recipient but also the donor, and I lastly discussed the donation process. In order to see the importance of donating blood, we have to believe that 1 pint of blood is enough to save someone's life. Remember why donating blood is important, because it can help you, the donor, and the recipient, and just going through the whole process is actually a fun experience. So, be a hero, it's in your blood.